Okay, so currently we are all going towards winters. So it is a very common question which people think of. So cold weather doesn't necessarily only mean change in temperature. It also means change in the quality of air around us. Let's say humidity. So humidity reduces during cold. It also means that some particle pollution which used to stay at a higher level comes down because the air is heavier. It tends to settle at the bottom. So cold is not only associated with temperature, that is the first thing. So for us human beings, air is a quintessential element for survival. It is an element in itself because we cannot survive without it. We extract oxygen and other things from air. So dryness causes direct irritation to our airways, which directly are exposed to the atmospheric air. Apart from that, the cold or the change in temperature itself causes the mucosa to be not only irritated, but it also reduces our ambient or body temperature both. It takes some effort or some extra effort on our body side to generate the required heat. So temperature regulation is the third issue. The fourth issue is, while doing all these things, our heart, our lungs, and our organs like the skin, the largest organ, has to work harder than normal. So cold is essentially a time when your body has to work slightly more than a normal baseline level. So this is how cold weather affects us. Plus, it leads to multiple medical problems like irritation of the airways, leads to inflammation. It can also lead to worsening of airway problems like obstructive airway disease, asthma, something like that. The increased heat generation, which pushes the heart to work slightly more than normal, also causes an increased cardiovascular events. It sometimes leads to excess joint pain and things like that, because the blood vessels also constrict in response to the cold, and then while increasing temperature, the increasing work that your body does, it also takes a toll on all other organs too. So heart issues, lung issues, joint pains, and reduction of basic immunity due to cold exposure is how the cold affects us. Okay, so as we have now got to know how the cold affects us, we can take certain precautions step by step how to protect ourselves. So first of all, never ever ever feel that if you are not feeling thirsty, you don't need to drink water. As I discussed earlier, that your vessels will vasoconstrict in cold. Your body will function at a higher metabolic rate to generate heat. So your body will need slightly more, if not the same amount of water even during winters. So make it a point to remind yourself to stay hydrated. That is the first and foremost thing. Hydration is a very, very undervalued strategy both for athletes and sports person and for normal people too. Apart from hydration, I would say the other thing we can do to protect ourselves is, as there will be a lot of viral illnesses around, we can wear a mask around people who are affected. We can also stay away from pollutants where we see them. Not necessarily stay indoors always. It's impossible to always do that. So we can try and expose ourselves to air when it is fresher, let's say early mornings or evenings, but we should stay away from pollutants as far as possible. Some things like protecting ourselves from the cold can also be translated to skin. So let's say some moisturizer or some cold cream if you have a case of dry skin. Then the same can be done for your hair, your hands, and other parts of the skin as well. Because as you would be aware that temperature reduction or heat loss is not necessarily through some specific part of your skin. It can be possible through any part of your exposed skin. So covering your skin essentially is also important. And after doing all that, basic mucosal integrity and immune system of the mucosal system, which is the first line of defense to atmospheric air, is very important. So what do I do? Something like steam with some turmeric can do wonders. Some hot kavas or some traditional remedies like neem in hot juice or adusina pan or some other things which maybe your grandma would have been doing when you were young and which you stopped. So all those things help protect ourselves and prepare ourselves better to enjoy the winter. Okay, so very interesting question which we get asked very often. So people come and tell us that some kid telling है नहीं मेरी मम्मी ने ना बोला आइसक्रीम नहीं खाने का नहीं तो मैं बीमार पड़ जाऊंगा. So some people tell their kids they don't drink cold water otherwise you'll fall ill. So the cold water or ice cream or anything cold in general is not going to cause a direct cold and cough. It is viruses which cause those cold and cough, not the temperature change. But what does the temperature change do? So as discussed earlier, it reduces our mucosal response and our body's immunity to fight towards it, and it causes local irritation, and in some cases a reactive airway may also go under spasm, so bronchospasm or any other irritation. So it will increase, aggravate the infection which is already there. It won't cause a new infection per se. So yes, if you have a cold and cough already, avoid cold things and have a propensity to go towards warmer fluids or soups or steam. But don't think like that if I don't have anything I'm perfectly okay, if I drink cold water I'll fall ill. That is only a myth. So go out there and enjoy the winters responsibly.
Okay, sir. Thank you so much.